What's up, everyone? We are back for another episode of Behind the Counter, and today, I don't really know the right way to phrase this. We're going to go to our perspective. We've talked a little bit on the show about prescriptions and controlled medication that help with stress, anxiety, sleep, all that kind of stuff. So there's a lot of behind-the-scenes stuff. Pain management's a whole nother ballgame when it comes to that, but a lot of the stress, anxiety, and medication we've talked about that we dispense are all controlled. So there's a lot of behind-the-scenes stuff that happen at any pharmacy, not just our pharmacy, about what we see, things that go on at the counter, when people can get the medication, when they can't get the medication. So we kind of wanted to illuminate some of that process for everyone who's watching at home today.
Sure. Well, I mean, to start off, a lot of times, one of the most common question that I get is, when can I fill this drug? And, well, when you're due, really, that's the answer to that. But a lot of times, and obviously there is some frustration comes from our patients saying they want medications at a certain time and they can't get it, and it gets a little frustrating overall from both ends.
Sure.
And, of course, the medication is controlled for that reason, because rather than using the word addiction, I like to say your body can get dependent on it. You don't, for example, just because you take those medications for anxiety purposes, I'm sure we talked about benzodiazepines, like alprazolam, lorazepam, all that stuff. We don't take those medications to, for fun. People are actually very stressed or have very anxious moments or even up to panic attack. They need to pop a pill, so-called. However, there has to be rules and regulations to govern those medications so that it doesn't ultimately hurt the customer, hurt the patient.
Why is that? So why are there these restrictions on all this kind of thing?
So to follow up on what James had said, he said it very plainly. He said, when your medication is due. So what happens back here as we're processing your prescription is, if your doctor is prescribing you 60 pills to take twice per day, that means that bottle will last you 30 days. So when you are due is technically in 1 month.
Right.
Oftentimes the insurance company, or there are some exceptions where obviously you may not be able to get here on exactly the 30th day. So there is some leeway. We're not totally strict on that. Just to follow up on that, that is exactly...
we do whatever we can do to, how should we put this, try to follow the rule and at the same time understand the customers. Because, as the question Vince asked, your body sometimes needs it, many people, I'm assuming probably almost most people that comes through the pharmacy or even just having everyday life, we're under a lot of stress. And a lot of anxiety for that reason. And it's just really fine line of try to endure and cope with those anxiety different way other than taking pills.
Sure.
And there are just some certain situations you just have to take that medication. So it's really a fine line on that.
So what do we see? Oh, sorry, what are you going to say?
That's okay. And to circle back to the original question, why is it so stringently controlled, is exactly that. Sometimes people tend to be a little over-reliant and may not follow the exact instructions on the bottle. And because these are controlled substances, it's strict because we are hoping that our patients are adherent and following exactly the instructions on there and aren't overdoing it. And that's often the case when customers run out of the medication too early.
Sure. So here's a question. So Sheldon and James obviously are here at an independent pharmacy now, but Sheldon used to work at a corporate retail chain pharmacy. Here at an independent pharmacy, we know our patients really well. Some of them we've been helping literally their families for 40 or 50 years, longer than any of us have been alive, honestly. So sometimes when we're here and we say we can't bill this because the due date is the due date 30 days from now, people are like, I've known you for however many years, why can't you help me, blah, 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 that kind of stuff. So what on our end as a pharmacy do we see from the DEA and other agencies like that as far as dispensing controlled medication goes?
First of all, it's actually, we are helping you by not filling that prescription early in the long run. It may not seem like it at the moment, but it's actually helping you because we are trying our best so that you are not overly reliant on it. A DEA certainly checks up on this every day. New Jersey specifically has something called prescription monitoring program where all the pharmacies will actually send a report to DEA every single day, and they compile a list so that if you are, and actually other states are now involved in this as well. So if you were to get a control medication from any pharmacy in the state of New Jersey, we will know. And that's strictly for control medications, so that that obviously helps to prevent doctor shopping, also help prevent pharmacy shopping as well. But it's, and you're absolutely right. We've been here for over 50 years, and I personally been here almost 10 years now, and we do our best to help the customers, and we try to figure out different ways to cope with it, where different type of supplements, or just plainly we can call the doctor's office and explain to the doctor, listen, this person is having this much issues. Is there possibility for an emergency supply of a maybe different medication? We do our best to help the customer and help our patients. But the one thing that we just want you to know, everybody to know, is that we are actually on your side. We are not against you. We are not the gatekeeper. We are actually trying to help you.
Right.
It's just that we just need you to work with us in the long run, so that we can help you the best as we can.
I think ultimately too, the way a lot of these things work, and not just for these medications, but for others too, it's kind of what you said. We're trying to help you. It's designed so you're not over reliant on these things, because it's not even necessarily your fault. That's the mechanism of how these things work.
Sure.
And it can
you don't have control over it.
Right, exactly.
Yeah.
To add on a little bit, generally people who are taking painkillers are also prone to taking these type of medications. Well, you're in pain all the time and you're taking painkillers, and that leads to anxiety and unfortunately all these different things, and that's actually adds up to a cocktail. There's like a red flag now on certain mix of medications, I guess we can say, right?
Right.
And that's in the PMP or separate from the PMP?
It's just common knowledge, I guess, within the pharmacists, I guess, or in the healthcare professional.
In the program, it doesn't necessarily pop out at us, but it's something that a lot of pharmacists and doctors would recognize that.
And what does PMP stand for again?
Prescription monitoring program.
And are you down with PMP? Yeah, you know me. Sorry.
Anyway,
I've been saving that one up for like 5 minutes now.
You've been waiting.
I know.
But I think those are all good points, and I think ultimately at the end of the day, I mean, again, we're trying to help people get off some of their medication and not be reliant on their medication like that. Even some other medication that's not controlled necessarily. It's not good to be reliant on anything, I don't think.
Yeah, it's a really difficult topic, and it's a really heavy topic as well. I mean, as our show Behind the Counter, we try to keep them casual, but this is a pretty serious issue. The drug cocktail, the whole reason they came up about is because people are actually dying, literally dying from taking all this medication all at once. Suffer from just flat out stop breathing, I guess, at one point. And some people who actually stop taking the medications and not following the rule, unfortunately, can lead to withdrawals and cause more issues. So it is a pretty heavy topic and serious topic. It's and it's very difficult. There are certainly very difficult situations that we go through. But at the end of the day, you just have to bear down and just trust the pharmacists and trust your doctors, and hopefully, help us help you, really.
Sure. And I think it's kind of like in all of our episodes we've done, it's important to have that relationship with your pharmacist, your physician, to kind of have everyone work together to come up with a solution. Like it's kind of a catch-22, right? You're anxious, so you're taking this medication, and then you can't get this medication, so now you're anxious that you can't get your medication, and it just kind of is like, it's a vicious cycle. It compounds and that kind of stuff. You know what I mean? So I think that's why it's important to have that relationship, because there are other things that we try to recommend to help people with. Hey, maybe try some of these over-the-counter things or supplements. Instead, we can try to work on some of this kind of stuff. It's more natural. So I think it's important to have that relationship as well.
I think overuse is definitely something that's an issue. I think everybody can agree on that. I actually had customers asking me about taking those type of medication because they're going on a trip. And
so flying on a plane kind of
thing?
No,
not even flying on a plane, and they're a little nervous about it.
Sure.
And sometimes some of these emotions, nervousness is actually normal.
Yeah.
You want to feel those emotions, and some people come in because they had a whole life issue, obviously someone passing away, some close member passing away, and things like that. And I try to tell them, listen, of course, the medication is here to help you, but those feelings are normal.
Right.
Of course, you'll be sad if one of your close family member passes away, and you will suffer from it. It's actually enduring the process is also something that we just have to go through, and instead of just opening a bottle and taking a pill, it doesn't make that go away.
Sure. No, living in the reality of the situation, that kind of stuff
Absolutely.
is good.
Yeah.
Or it makes sense. That's why there's a lot of stuff out there. We're doing another episode on meditation or therapy or those kind of things for the bigger issues. Obviously, travel anxiety or something like that.
Right, that's something trivial,
or,
obviously.
Wedding jitters or something like that.
Sure.
No, but like you said, like with that kind of stuff and even the supplements and the OTC things, a lot of that is used. It's literally called a supplement. It's to not just supplement your body, but to supplement other medications that you're taking as well.
Right.
So you can see, some of our patients are weaning off of the medications that they've been reliant on and using more natural over-the-counter supplements that have less negative side effects.
Sure, and less tendency to be dependent on it.
Yes.
Rather.
Is there anything else you guys want to add about this? I know it's a hot topic before we...
It sure is, and
wrap up.
I'm sure a lot of people will have opinions and open. We are certainly open to discussions as well. But it just have to remember. It's all the stress. It becomes up to a point that taking a pill, kind of, you feel like you're gonna get rid of your stress. It doesn't. The stress is still there.
Yeah.
The best way of coping with stress is actually go fight at it and figure out things to get it done. And sure, these medications and counseling obviously is one of the major things that the people can do. They're more of an adjunct thing so that it'll help you, aid you to get through the process.
Sure.
Not going to replace it.
Sure. That's a great point.
Yeah.
Cool. Any questions, please let us know. You can find us at hbpharmacy.com or gasparsbest.com, and we'll see you on the next episode. Thanks.
Thank you.
Thank you.
Well, now I've taken this. Am I going to get high now?
Okay. That's a good one.
We do get that a lot.
Yeah.
I guess fortunately / unfortunately, no, it's not going to make me high. It does, even though it does have a trace amount of THC in it, it's purely used for the purpose of the medicinal use.